Hi everyone. Let's transit to our second topic, STD or sexually transmitted diseases. These diseases represent massive global and domestic health burden. Worldwide, there are over 1 million new cases daily. And imagine in US incidence approaches 20 million new infections annually. So our guiding philosophy here is the universal assumption. Because viral shedding happens without visible lesions, and because many infections are completely asymptomatic, so we must treat all patients as if they are potentially infectious and rigorously adhere to standard precautions. So let's start with the first infectious disease, which is gonorrhea. Gonorrhea in the oropharynx is often completely silent, and when symptoms do appear, you might see an erythematous pharynx with tiny pustules or enlarged tonsils with the yellowish exudate. And lymph node or cervical lymphadenopathy may be present. The diagnosis of gonorrhea is typically via a special test called NAT or NAAT. And the medical management requires dual therapy, usually two antibiotics, ceftriaxone and azithromycin. And from the dental perspective, promptly refer symptomatic patients. So those patients who are symptomatic, we should refer to a physician or specialist. And know that dental care is generally safe few days after antibiotic therapy has begun or initiated. Next, we will move to another sexually transmitted disease, which is syphilis. Syphilis is also sexually transmitted disease, and it is caused by a bacteria called Treponema pallidum. Syphilis presents in three distinct stages: primary stage, secondary stage, and tertiary stage. Primary stage, which is called primary syphilis, this is the highly infectious stage and featuring a solitary painless indurated ulcer that may occur in the lips or on the tongue or any other oral mucosal site, and it's called chancre. Then secondary stage, also highly infectious, and it presents with grayish white mucosal patches or mucus patches and maculopapular rash. There is also systemic manifestations such as fever, malaise, and generalized lymphadenopathy. The tertiary stage, there is specific lesions called gamma granulomatous lesions with central necrosis, usually in the palate. And also there is involvement of the tongue with glossitis or atrophic glossitis or interstitial glossitis, which is potentially malignant link. There are also congenital syphilis, in which the bacteria can get through the placenta from the infected mother into the fetus. So the newborn or the infant will get developmental anomalies in the teeth, such as Hutchinson's, incisors, and mulberry molars. There will be changes in the morphology of such teeth. Okay, so for dental management, we need to consider the serological monitoring, and sometimes there is a hypersensitivity reaction or acute febrile response within 24 hours after starting treatment for this disease with antibiotics. Also, one of the most important sexually transmitted disease for us as a dentist is the herpes simplex virus infection and human papilloma virus. So with herpes simplex virus, infectivity is highest during the papular, vesicular, and ulcerative stages. And elective dental care must be deferred until these lesions have completely crusted over, not in the active stage. So after crusting the lesions, then we can start the treatment. So that's to prevent the auto-inoculation risks زي مثلا for example herpetic white low. If you touch the lesion with your finger during the active stage, so the virus can transmit the infection into your hand or your fingers, or ocular herpes. And with the human papillomavirus, we see oral condyloma acuminatum caused by human papillomavirus. It looks like the warts that occurs in the skin. So critical safety note here is vaporizing these lesions with laser can create a plummet that contains infectious human papillomavirus virions, and you must use high volume evacuation and N95 respirator or medical mask to prevent inhalation of this virus. So our protocol here are straightforward but not negotiable. You cannot negotiate about treating every patient as if there is a high risk for transmitting the infection. So differ care for active syphilis and herpes simplex virus, and never touch any active herpetic lesions with bare hands, always with gloves, and never perform procedures without protective eyewear for both you and the patient, and use high volume evacuation, which is mandatory for all aerosol generating procedures. Okay, in this slide we are showing some infection control protocols. So treat all patients as potentially infectious, perform rigorous hand hygiene before and after gloving, use high volume evacuation, report new cases of syphilis or gonorrhea or HIV or AIDS to the local health departments as required. PPE is essential: protective or personal protective equipment, surgical masks, gloves, face shields, etc., to prevent the transmission of infection. Okay, now let's look at this scenario. 28 years old male presents with painless 1.5 centimeter ulcer on his tongue that has been there for 2 weeks, accompanied by rash on his palms and soles. So what's the best immediate dental management in this case? Okay, you can pause the video and try to solve this case. Yes, the correct answer is B. You need to defer any elective care, as we said, and refer for serological testing for syphilis and medical treatment, and we need to adhere to the standard precautions. Okay, to wrap up our session today, remember these core clinical peers. For chronic kidney disease, timing is everything. Treat on the day of non-hemodialysis session or after dialysis. Strictly avoid non-steroidal anti-inflammatory drugs and anticipate bleeding even if platelet counts are normal, and also risk of infection. For sexually transmitted diseases, treat everyone as potentially infectious. Protect yourself from viral plumps and use high volume evacuation, and defer care and refer patients when you identify active infectious diseases or lesions. Okay, thank you for your time, and see you in next videos.